Okay, you're good.
Hi, good afternoon, Board of Health members and Tompkins County Health Department staff and mental health staff. I see we've got Harmony again, as well as all our guests who are joining online for our April Board of Health meeting. So we'll go ahead and call the meeting to order. I don't believe we have anybody for privilege of the floor today, Frank, is that correct?
Correct.
Okay, so I'm going to go ahead and move on to approval of our March minutes. If I can get a first and a second. Okay, I'll take a first from Melissa, a second from Shauna. Any discussion on those? Okay, all in favor to approve as written? Anyone opposed? And abstentions? I think that was unanimous. Okay, great. So Frank, I'm going to move to you for the financial summary.
Sure. Probably the most important part of the financial summary is Brenda is back part-time. She is unable to be here this week because she's dealing with some personal matters, but she is back part-time, so it's great to have her back. And I know Karen Johnson is very happy to have her back as well. So they're working diligently on all the financial and budget information. We are beginning prep for the 2022 budget already. So I'd imagine next month she'll be able to catch you guys up on where we are. But otherwise, I believe the documents in the agenda, and I'm happy to try to answer any questions.
Okay, great. Any questions on the budget? Okay, Frank, I'll go ahead and just move forward with your administrative report.
Great. So the COVID updates this week are, I think, mostly good. We have seen steady decline in the case numbers. We had a 0 case day earlier in the week, maybe it was Sunday or Monday. It's a little tricky because there's less testing being done on the weekend. So generally Sunday and Mondays we do have, and even Tuesdays, slower days. But it was still good to put a 0 up. Right? I think it made everybody feel good. So that's good news. And on the vaccine front, we hit the tipping point last week where we now have more vaccine than we do arms to put it in. We've been running steady weeks between 2,500 and 3,000 doses being administered here locally for a couple of months now. And last week we had a Cornell on-campus clinic. CHS was partnering with Cornell to do a large-scale clinic there, and a normal Saturday clinic at the mall. Again, for Saturday, trying to get folks that might work Monday to Friday and couldn't get there. And both of them filled up about half capacity. So that was really the first time that we've run into that. Counties around us have been dealing with it for a month in some cases because we've been taking vaccine from them for that long. But this was the first time that we kind of hit that tipping point. So we knew it was coming. And it's actually a good thing. It's a good thing that it's happened when we have so many people vaccinated. We're close to 60% of our population with a first dose. Many of the counties around us are in the mid to high 30s, and they've been struggling to get arms for a while now. So our community really stepped up once again and has sought those vaccines out. I think the
Oh, we lost Frank.
Population, depending on who you ask. So, when you add that to the 60% that we're getting close to 75% of the population that's eligible. The 75% of the population is either vaccinated or ineligible for the vaccine. So we're down to that last 25%, which we always knew was going to be the most challenging group for multiple reasons. The first thing that we're going to try to overcome is any barriers. So we've been doing small pop-up pods in the rural parts of the county We did one at Lehman Alternative School a few weeks ago, not really rural, but a pop-up downtown. We were in Groton this past weekend. We're going to Newfield on Thursday. And then we'll be planning Dryden likely as our next one after that. So we're gonna continue to go out and hit each of the municipalities and try to find the most appropriate location in each place to continue to make vaccine available to folks close to home.
And Frank, before you move on, maybe you or Sam, just for folks who are watching at home, can you just remind everybody of the clinics that are available on Thursday and where they can find the links for those to register?
Sure. Yeah, so we have 2 clinics on Thursday, a standard clinic at the mall, and we're also doing the Newfield clinic. So it'll be at the Newfield Elementary School, and you can find links to register for both of them on the health department webpage, or you can call 211 to make an appointment for either of those clinics.
Great,
they will be Johnson & Johnson clinics. So that was the next thing to hit. The Johnson & Johnson vaccine has been released for administration again after thorough review by the Advisory Committee on Immunization Practices. They made the recommendation to move forward with J&J with no additional restrictions. So anyone over 18 years of age, 18 or older. But they have added the language around the blood clotting concern into the emergency use authorization fact sheet that is available and that we provide at the clinics to folks that receive the vaccine. I'll let Dr. Klapek talk a bit more about the medical side of that. But I did want folks to know that we are moving forward with Johnson & Johnson, both at the mall and Newfield, partially because it's available and we have a lot of it, and partially because we want to kind of gauge how people are going to react to it being those types of clinics. So we'll use it. We do have Moderna available, so we'll be doing Moderna clinics again in the future as well. I will tell you, we have about 7,500 doses on hand right now, split between J&J and Moderna. So we have a lot of vaccine on hand, and it will give us the opportunity to move it out into the different communities and through different mechanisms. And before I turn it over to Dr. Klapek, one other thing, we have restarted doing the homebound individuals now that we have the Johnson & Johnson again. So starting tomorrow, we'll be moving to Monday, Wednesday, Fridays each week, doing 15 folks a day until we get through everyone that's on the registry. There's about a little over 100 people. So we're just going to keep plugging away at hitting those folks as we can, going out to them. So Dr. Clay, oh, sorry, go ahead, Dr. Donnelly.
Do you know what percentage of the 16 and 17-year-olds have been vaccinated in our county?
I don't know the answer to that. I haven't been able to kind of figure that out yet. I'm struggling to find out how many 15 and 16-year-olds we actually have. First of all, I do know we did a special link for 16 and 17-year-olds last time we had Pfizer. From the registry, we put out 300 emails and got 152 people registered. So I don't know if those other 150 went to a state site and got vaccinated, but we did do a special opportunity for them. And we're hopeful that we'll be able to find some additional Pfizer. I'm actually meeting with my colleagues in the region tomorrow to see if there's a way we can figure out amongst all of us if we can accept 1,170 Pfizer doses and then split it out into smaller batches. That's the way the state has told us we could access it. So we're still trying. If we're able to manage that, I know some of the school districts have voiced interest in potentially doing something on their campuses, which we would be open to doing to try to reach those populations.
Shauna.
Hi, I was wondering if you've received feedback from the older population in regards to the Johnson & Johnson vaccine. I spoke with my grandmother last night, and her and my grandfather tune into a certain news channel that seems to be scaring older adults into getting that vaccine. And I just wanted to see if we had noticed that here.
Yeah, so the good news is, according to the state data, we've reached over 80% of the people 65 plus in the county. So hopefully there's not too many out there still needing to be vaccinated. It's too new, Shauna.
Yeah.
The reauthorizing to know where we are. That's why we're on Thursday, we're doing a full Johnson & Johnson day to kind of get a feel for that.
That's great.
And when we do schedule the homebound folks, which honestly, it's about 50-50 between seniors and non-seniors in that homebound group. It's not, homogeneous to seniors. So we'll get a feel for there, but I think we'll know a bit more in the next few days on kind of where folks are feeling. And then we'll have to figure out, do we need to do further investigation and see if that is a holdup, or if really we're just at the point where we're down to those folks that either are really hesitant or have decided not to be vaccinated.
Great, thank you.
Dr. K, did you want to talk any bit about the J&J and the?
Sure, I'd be glad to. I think that one needs to start by saying that the process, the safety measures that are in place for the rollout of these vaccines is working, and that it's been very effective. This kind of unfortunate side effect is very, very rare. You're only talking about 1 to 2 per million persons vaccinated, and only in actually a certain gender group and a certain age group. So the system worked the way it was supposed to. This type of very rare event can only be detected when something is used in the general community. We only find things out about medications that are put out, new drugs and vaccines. We only find some things out only after they have come into general use. And then the system is designed to respond to that, modify the recommendations, alert physicians, alert healthcare facilities, and that is what happened. In fact, the entire system was primed to find this at as early a point as possible, because knowing the AstraZeneca vaccine has this type of issue in Europe, and knowing that the J&J vaccine and the AstraZeneca share a little bit of the common technology, the CDC was intensively looking at adverse reports that were being filed through the VAERS system. So they were right away, any report that came in that seemed to be consistent with a clotting side effect, they were exploring in an expeditious manner. And very quickly, they act to pause the vaccine in order to gather further information and decide how to go forward. So now we have the J&J vaccine and back on track, and we know more about it than we did before. I think it is not unreasonable to reassure people above the age, certainly of 60, if not 50, that this is like not particularly an issue for them. Everyone who has been affected by this problem has been under the age of 50. They've been between the ages of 18 and 50, and they've all been female, except for one case in the vaccine qualifying trials, which was a male in their mid-20s. And there were no males subsequent to that. So for males in general, and for persons outside that age range, I think it is justified to offer some reassurance that if this happens at all in those groups, it's extremely, extremely, extremely rare. And even within the age group of being female and between 18 and 50, this is a rare event. That doesn't mean that they don't need to be counseled about it, and they need to make their choice. There can be circumstances where they would choose to have J&J vaccine, even if they're in their 30s and female. COVID has a fatality rate. COVID has a hospitalization rate. And depending upon who you are and what your other health conditions are, you are more or less likely to end up in the hospital or potentially even to die of COVID. We always, in doing medicine, are constantly balancing risks and benefits. When I prescribe a medication for someone, let's say for heart failure, or even an antibiotic for an infectious condition, there's always a risk that you might have a complication. You're always balancing the risks and the benefits. And you're always making the judgment that it's worth taking this medication, it's worth having this vaccine because the risks are higher. So COVID isn't going away, and it won't go away until we achieve enough herd immunity or community immunity to stop it. And the longer that we go without stopping it, the greater the risk of mutations that are going to be potentially a very serious problem. So I think as we continue to use J&J vaccine, particularly if you're female, particularly if you're between 18 and 50, we want to make people familiar with what the issues are and let them make their choice. Some of them will choose to have the Johnson & Johnson vaccine because of any number of factors. And some will say, I'd rather do the Pfizer or the Moderna. And isn't it lucky that we do have, in this country, some choice? I'd be glad to entertain any questions that anyone might have.
A question for either you, Dr. Klaypak, or Frank. Do you see many people not showing up for their second Moderna shot?
There's an attrition rate. It's anywhere between 5 to 10% is what we've been seeing each time. It's gotten bigger as the weeks have progressed. Right, early on, everybody was showing up, and now we're starting to see that attrition rate grow a bit larger. But so far, it hasn't been a dramatic shift. But we definitely do have some attrition.
I think it's important, probably, Frank, to note for the general public that, to my knowledge, correct me if I'm wrong, we have not had anybody hospitalized due to any complication from a second dose of either Pfizer or Moderna. And the longer lasting immunity, we believe, requires 2 doses. And I think there's been a lot of fear about the potentially worsened reactions after the second dose. And for sure, some people do have a worsened reaction. Other people have less reaction or maybe the same. So it isn't the same for everybody, not by a long shot.
Okay, great, thanks. Any other questions? Okay, and I just wanted to also say thanks to the health department and the staff and Cuga Health System for everything that you've done on this, because the county response on this, I think, has been really amazing. And so everyone out there listening, get your vaccine, please. That will help keep us protected as a community moving forward. Okay, Sam, health promotion. Frank, are you done? Okay.
Yeah, I'm done. Thank you.
I just wanted to double check. Okay, Sam, health promotion.
Hi, everyone. So I don't have much to add to the report, but I did want to let all of you know that we have yard signs available with the together kind of imagery. So I'll put a link to what that poster looks like, but the yard signs are similar. And if any of you would like one to put near your house or somewhere else, you can just email me and I'll set up a time to get it to you. So thanks.
Thanks, Sam. I'll take one.
Okay.
Can I get a personal delivery from you since you live near me?
You and Melissa can get
And it looked like Ed raised his hand, and who else did? And David and Sue and Shauna. So if there's a way to get maybe one to all of us, that'd be great.
Awesome. Thank you.
Yeah. Dr. Klaypak.
No, thank you, Christina, and good afternoon, everybody. Um, I just want to point out, I guess, dovetailing onto the Johnson and Johnson discussion, this isn't unusual, as I mentioned, for things to become evident as we have a medication that becomes used. And it's not unusual to have certain subgroups to whom a medication shouldn't be given, and for whom it's contraindicated. So this type of situation where we now have identified an at-risk group for this Johnson and Johnson vaccine, this is just how medicine is. We identify groups that are more predisposed, perhaps, to have a particular side effect, and so then we use that going forward to make our decisions about which medication to use, which vaccine to use, et cetera. And in our counseling of patients and of the public. So there's nothing unusual about this, and it's not due to any kind of slipshod handling of the situation or any government conspiracy or cover up or you name it. This has been very transparent, this whole process. And the meetings have been all on the ACIP meeting where I was on the web and so on. So this has been a very transparent process and one which I think has been handled in a very responsible manner. I did include a lot of information for you as I did last time in the packet, and I don't have anything particularly to add to that, but I'd be glad to answer any questions anyone has.
Ed.
Thanks. So no, I was kind of curious when about trying to get the vaccine to medical offices, and I wonder about the difficulties of that, doing it on a smaller scale because of how the vaccine comes packaged and how it has to be utilized in such a certain period of time. Even the J&J would can be refrigerated for 6 hours and kept out for 2 hours. So that can be really difficult to get the numbers that an office would need to be able to utilize that. Can you comment on that and how that might go forward?
Frank can add more to this, but I think the biggest challenge hasn't necessarily been for the offices that get vaccine, as it has been that when they go through a list of patients who have expressed an interest and so on, they may very well find that a sizable percentage of them have already been able to get vaccinated. And so as they roll out their vaccine clinic, they may have fewer people than they anticipated. But we've handled that well, I think, in that there's been a close cooperation between Cuba Health System and the private offices and the health department to reshuttle and reshuffle that vaccine. Frank, you have on the ground experience with shuttling those things around, et cetera. You probably have things to add.
Yeah, it's a tricky question, Dr. Capel. I think we have vaccine available. We've taken vaccine from some of the local providers that were unable to get it administered. It's really going to come down to this wastage issue and when we get comfortable with some wastage, right? Because the thought that the minute you puncture a vial, you're now on a very short clock, essentially that day. You need to know how many folks are coming in, and there's very much angst, as there should be, about any wastage of doses. But at some point, unless the vials get smaller or they come in pre-filled syringes, it's going to be similar to other vaccines, right? That you try to schedule folks and you do your best to, use up everything that you have. But if you waste a dose, it's not the end of the world. And we're not there yet, unfortunately. So we're kind of in this middle ground, and like I said, the switch flipped on us pretty quickly this week, right? We've been humming along doing thousands of people, and then all of a sudden we didn't have enough. We knew it was coming. And I think now we're just reacting to, what's the best way to kind of move forward. Some of it will depend on the federal and state relaxation of some of the rules around the vaccine, including calling something a second dose versus a first dose instead of just being a dose, and using it where it's appropriate. So some of those things will begin to relax as this happens across the country. And I think then it'll be a little easier for the private practices to be able to manage vaccine.
I think, correct me if I'm wrong, Frank, but to my knowledge, these are primary care practices by and large that have stepped up to do vaccination. Although one of the dermatology practices stepped up to do quite a few vaccines, Dr. McAllister's practice. And they ramped up to do a very organized clinic setup so as to maximize cold chain and avoid wastage. And as far as I'm aware, I'm not aware of any real wastage that has occurred. Am I correct, Frank?
Yeah, that's correct. Any of the primary care offices that could not use vaccine redistributed it to us, and we used it. But I am not aware of any wasted doses. And in fact, I am only aware of 6 doses that have been wasted since we started this. And that was all because of needle failure. So when you think about, we just crossed 50,000 doses done just by the county and the hospital system. That's pretty phenomenal success rate in getting it into arms. So yeah, everyone's done amazing work trying to treat this vaccine like the gold that it is. And we're just going to have to adapt as we move forward.
Yeah, thanks. I think it's going to be easier for the larger offices to do it if they can get like a vaccine day or something for their patients to come in, then it's easier. It's not just kind of a one in the office for each patient who's coming in. That might not work as well. All right, thanks.
Great. Other questions? Sue?
Yeah, Dr. Claybeck, you mentioned the Excelsior Pass as a verification that people have been vaccinated. Is there any indication that people are going to start using that?
Well, I think it's a gradual process, Sue, in terms of how things open up as we go forward. There is some indication that the European Union will be allowing some travel into Europe, particularly for people who are vaccinated, in the summertime or thereabouts. But you'll have to show either a recent test, as I understand it, or recent vaccination. To my knowledge, I don't think the Excelsior Pass has been really rolled out to be extensively used, but that's partially because we're not really opened up all that far. And as you know, there's people who are kind of looking at this from multiple points of view. So in a way, one can look at it from one side of the coin and say, wow, this is great. I get a benefit for being vaccinated, and that benefit is based on realistic science and realistic public health, which says that if you're vaccinated, then it's safer to be amongst other people, and then you can be in a venue that if you weren't vaccinated, it wouldn't be so safe to be in. If you're of a mind to look at it from the other side of the coin, then you feel like you're being discriminated against. But this isn't discrimination in the sense of you have blue eyes and I have brown eyes, and you blue-eyed guy, you're not welcome here. This is science, this is public health, this is disease, this is a fatal disease. It's not something to be played around with. So I think the Excelsior Pass will allow for things to happen that wouldn't otherwise be safe enough to happen as we move forward.
Great, thanks. Other questions? All right, Claire, you're up.
Good morning, everyone. Hopefully all the juicy details are in the report that you can review. I would just like to kind of thank the team and just note the tremendous flexibility and resilience that the staff demonstrated this past month. Working on COVID surveillance, people did an amazing job to get some emerging clusters that we were talking about last month under control. And so we are seeing cases fluctuate with lower cases each day. That's happening more and more. And we passed the spring break kind of marker and some increased openings, but we expect that the community will continue to act responsibly, maintain distance, mask up, test if they're symptomatic, and generally, help us to keep cases low. I would say, as time goes forward, we are seeing some repeat positives, cases that happened over 90 days ago that are becoming cases again. And we're also seeing a lot of contacts who have been fully vaccinated at the time of exposure, and so they're exempted from quarantine if they are asymptomatic. And that's a great, a great sign for the continuation and function of essential services and schools. So we're really pleased about that, and just serves as another testament to the importance of fully vaccinating the community. This past month, we have been working, the nurses with community health, have been working with CSCN nurses and other partners to support COVID vaccine efforts with home visits that have gone really well and that have been quite successful, and also begun rural health clinics for vaccine as well. So we'll continue to do those as the need is there. In non-COVID news, we included sort of WIC updates from the previous months that hadn't been included. They have continued to provide services, as I mentioned last time, experiencing very high caseloads, and continue to provide telehealth services remotely. There was an annual 3-day WIC conference this past month that they attended as well. And we're looking forward to the RFA coming out soon for the next cycle. I think in light of what we've seen, fluctuations in cases, we expect that those might continue through June. And so we're going to integrate that into our planning as we consider restarting some of our activities. Some of them we've already begun. Anonymous HIV testing and rabies pre-exposure, for example. Safe care and maternal health services were in the planning stages to recommence those, but we're going to give ourselves a little bit of contingency to continue to focus our efforts on COVID as needed. Maybe I'd also mention we're still having challenges hiring for the 2 open community health nurse positions that we have. And so please do help us spread the word. Nurses are very high in demand, but we continue to project and hope that we can complete our team. And so appreciate your help with that.
Great, thanks, Claire. Any questions for Claire? I'm glad to hear that some of those other services are starting to reopen back up, and that we're getting to the point that we can kind of take a breath and start to refocus. So, okay, any other questions for Claire? Okay, Deb, if you could pick up with that on the children with special health care needs.
Hi, everyone. Our programs are fully up and running, and we still continue to help a little bit with the COVID work. Other than that, I don't have anything else to add to my report.
Great, thanks, Deb. Any questions for Deb? Okay, Jonathan, anything from the county attorney?
Not much. I mean, our big issues at the county now are when we're going to go back to in-person meetings, and when we're going to bring people back who are working at home and to what degree. And those are big issues around COVID right now.
Okay. Great. Any questions for Jonathan? Okay, Liz, is Liz here? I don't think I saw her. Skip, are you? Okay.
Yeah, I'm pinch hitting for Liz today. So, hi everyone. Yeah, I don't have anything to add to the report other than I do want to alert you to a correction in the existing report. It's on page 4 in the summary chart. We reported that Board of Health penalties collected was 500. It was actually 1,900 for March. So that'll be reflected in next month's chart.
Okay, great, thanks. Any questions for Skip? Okay, so are we ready for our enforcement action on resolution 210001, vape dragons? Okay, I'm gonna go ahead and put this, if someone can put this, give me a first to approve as written. I have a first from David. Do I have a second? Second from Sue. Let's go ahead and open for discussion. Any discussion on this? Skip, anything you need to add that we need to be aware of?
Just that this is something new. We haven't seen this before because the law just went into effect May of 2020. So this has to do with flavored nicotine vapor products. So in New York, those products are now banned. So this facility had it for sale and we observed it. So that's what the action's in regard to.
Okay, Sue?
Yeah, just you could clarify my ignorance. So there are vaping products that are tobacco based and have nicotine, and those are okay. And there's vaping products that aren't tobacco based and they have nicotine and they're not okay. Frank's shaking his head, that's wrong.
So actually, if it's tobacco flavored with nicotine, it's okay. If it's flavored with no nicotine, it's okay. And pretty much that's it. So it can be tobacco flavored or no flavor at all with nicotine, and it's okay for sale. If it's flavored without nicotine, it's okay for sale as well. But you can't have flavor and nicotine.
The idea is here is we don't want to be attracting children, right? That's the main purpose around not allowing the nicotine linked with the flavored vaping. It's the same like the flavored cigarettes or the gum cigarettes back in the day. But the idea again is we don't want to be attracting children to vaping.
Sure, understandable. I just didn't know there was such a thing.
Okay, other questions or discussion? Shauna?
Whenever the store was approached about selling something that was no longer legal, what was their response?
Yeah, so it caught us a little bit off guard because, given the time frame of everything. So we had to do some research on our end because they were under the assumption that the product that they were selling was one of those FDA, because in the law, there's like an FDA exemption for certain flavored nicotine products. However, there are no products that are currently FDA approved that are allowable for sale. Supposedly, through their industry representatives, they thought they had state approval for those products. So, once we observed it, they immediately pulled it from their shelves. Excuse me. We did go back to do a reinspection, and most of those products were off the shelves. They did have a few menthol flavored products, which also are not allowed. So again, they removed those products, and essentially, it's pretty much decimates their business because that's all they did.
And then my second question is, are there other places in Tompkins that are selling the same product?
Yeah, so the other standalone place that we were aware of is it's another facility. I think it's Unique e-cig. So we did go there just to make sure that they weren't selling those products, and they weren't. So, but you know, convenience stores, gas stations, other facilities could be. We've gotten out to do some checks, but we haven't been to every facility because of the COVID constraints. So we'll get there.
Okay, any other questions? Okay, are we ready to vote? All in favor as written? Okay, anyone opposed? And abstentions? I think that was unanimous. Okay. That is it for the meeting. Sam, I just want to come back to you really quick just because you threw something in the chat. Can you just say that verbally?
Sure. Yeah, I forgot to mention that we are hiring public health ambassadors in a project assistant role, and we'll be hiring them in early May. So I'm excited to bring on 4 people who will help us, continue with the vaccine rollout and working directly with community members and having conversations. So I think it will just add to the work that we've been doing, especially with the pop-up clinics. And the hope is also to equip these individuals with understanding of services and programs both at public health and mental health, and just furthering the knowledge and sharing information in the community. So I would definitely will have more to share next month, but just wanted to give you that update.
Great, thanks, Sam. Any questions or comments for Sam on that? Okay, any other business to discuss before we go ahead and adjourn? Okay, can we get a motion to adjourn just so we do it correctly, and a second? Okay, first from Melissa, second from Shauna. Any discussion about that? Okay, all in favor, we're good. Go ahead and adjourn. Frank, do you have anything else?
I don't. Thank you all so much.
Thanks, everybody.
Thank you.
Thanks, bye.
Take care.